tried to situate myself in a comfortable space just to make this feel a little bit like home so we can feel a little bit more connected. It's wonderful to see so many familiar faces from our community. I hope everyone is healthy, well, and optimistic. I want to just thank Dara. This series has been a labor of love for her, and we were able to seed it in 2020, and we're now expanding it in 2021. And it's just been a fantastic way to be connected to our wonderful community. Um, so I am Shanesha Sauls. I just want to say thank you, big thank you to you all again. As a reminder, BCF mobilized $8 million for COVID relief across all funds in 2020. There was a 50% increase among our donor advised fund holders in response to the crisis. In addition, our unrestricted grant making and our impact investing mobilized another $3 million to support neighborhoods and communities and small businesses. And about a year ago, we moved into a new building that actually, in some ways, provided kind of a home base for us to be able to do our great work. We're facing 2021, and one of the issues as we look towards COVID recovery is the challenge of mental health. So, for those of you who remember reading The Sun on the morning of the first day of 2021, there was an article that we are due for a level 5 mental health crisis. And that level 5 mental health crisis characterizes the various levels of stress, anxiety, uncertainty, and frankly, mental crisis that communities across the country and in Maryland and in Baltimore are facing. And there is increasing evidence that there's a disproportionate effect of this mental health crisis for all kinds of reasons that we'll get into today in communities of color, specifically Black and Brown communities in Baltimore. So this is a worthy topic. It's an important topic, and it's something that we're really going to try to get our hands around. Thankfully, I am not the expert on this. We have two important guests that will kind of lead us through this conversation. The first is our trustee, Dr. Trivedi, who is the president and CEO of Sheppard Pratt, as well as a BCF trustee. I had the pleasure of meeting Dr. Trivedi back in 2016 by actually a member of our donor community, where there was a situation where I was engaged with a young woman in crisis, and Dr. Trivedi, sight unseen, helped. He was able to deploy not only his head and his experience in adolescent mental crisis, but also his heart to do the right thing. So, Dr. Trivedi, I've never been able to publicly thank you for that, but I want to do so today. And in addition to that, he is leading the Sheppard Pratt, and he's a clinical professor of psychiatry at the University of Maryland School of Medicine. And he is a nationally renowned expert in healthcare, hospital systems, care delivery, population health, and behavioral health, and serves on many national boards that are at the forefront of thought leadership in the delivery of hospital care. Our other guest is also treasured. It's Miss Erika Robinson, who is the Director of Operations at Keys Development. Keys Development is a BCF grantee that we unearthed during our rapid response, COVID response in 2020. BCF funded Ms. Robinson's organization, Keys, through the Bon Secours Baltimore Foundation for Bon Secours Community Works. And its COVID-19 Heart and Mind pilot program was funded to support and facilitate training to address parent and child stress and trauma related to the COVID pandemic and all of its attendant effects. We were able to provide support so that families could enjoy it without having to bear the fees. BCF for the fees to support strong staff. It included program sessions, materials and supplies, program data collection and reporting, as well as administering and assessing therapeutic skills. Technical, we have two experts here who can give us a global view of this mental health tsunami, as well as the on-the-ground view. So I'm delighted to have you both. Thank you. So I'm going to start with a question to Dr. Trivedi. So Dr. Trivedi, we know that many people don't know how to start a conversation, much less engage in an open one about mental health. Can you explain more about this?
Sure. So first of all, I just want to thank all of the good work being done by the staff at BCF and all of you for your interest this morning in joining and all the things you're doing within your community and helping folks that you know. I think that's actually one of the most important questions to start off with. And what I mean by that is, you know, lots of times, if you heard that a loved one was just diagnosed with breast cancer, you'd know exactly what to say. You'd go running. You'd want to give that person a hug. You'd say, "Hey, what's going on? How can I help?" What, right? When someone ends up feeling depressed, sad, hopeless, maybe at their wits' end, the difficult problem is we actually don't know what to say, and many times we say nothing. And I think those are all missed opportunities. And so I think in terms of that first conversation, I guess some tips that I would really provide are, I think number one, you all have a lot of the skills by which to have empathic conversations. And I think uh, as opposed to knowing what to say, I would start off by saying we all need to know how to actively listen. And simple things. How's your day going? That must have been hard for you. Uh, Even the smallest words that you can get out that gives someone the opportunity to speak. I'm going to reflect on just about 10 minutes ago. I'm at the hospital. I walked to the cafeteria. There's a wonderful person in our environmental services staff who I see every day. And I just, as I'm getting my coffee, said, "Oh, how's your family doing?" I've had this comment like literally every day for the last, year now during COVID. He said, my son has kidney stones that aren't passing, and I'm really worried. And so I think sometimes, particularly during COVID, we don't stop to ask those basic questions. And so I say, in terms of communication, just checking in on one another is huge. I think when we see big things happen, and I will say, events in Washington, D.C., all the events from this past summer regarding racial equity, just being able to check in with someone and say, that might have been a little hard for you. How are you doing? And just being able to listen is important. The other big thing that I will say, and I think this is a mantra that's a good one, which is essentially, it's okay to not be okay. And I think particularly in a world where stigma is huge, where it is not okay to not be able to get out of bed or not be able to function as well at work or to be able to do the right things that your family or your workplace or the community expects of you, there's a lot of shame that comes with having a mental health issue. I will tell you, I still consider myself relatively new in town. I've been here for about 5 years, and I walk into plenty of rooms and places that I haven't been before. I can uniformly tell you, as someone who is a mental health professional, in every single room, someone will come up to me and tell me about the fact that they've been depressed, the struggle they've had, the issue that their child is going through, the fact that their parent is dealing with memory issues, other things. The fact of the matter is, it's in every single person's family. And right now, I would venture to guess there isn't a single person out there who doesn't know someone impacted by COVID and the mental health effects of COVID, right? And so part of the conversation for this morning is, I think, beyond just what can we say, how can we say it, I will say that there was a discussion about, well, what can we do? What does this look like? How do we make a difference? And so I'm going to start off with a little bit of what Sheppard Pratt has done during this time, and then kind of talk about struggles that we are seeing and we know exist, right? So I will tell you that my bias is that I am a child psychiatrist. I love working with children and their families. And so I'm going to start off with that group in particular. In that group in particular, I will tell you that one of the biggest struggles right now is not having a classroom to go to. And that is fundamentally important in a couple of different ways. First of all, virtual learning, if it's stressful on us as parents when technology doesn't work or things don't quite work out, it has been incredibly isolating for our kids. I would argue that just as important for a child as the education is actually the social interaction, emotional interactions, being able to play with friends and having those experiences, and that's all missing, right? You combine that with now, you may struggle at finishing a particular assignment. You may not have the help to get that done, or you may not know how to ask for that. And so I think there's a lot of new stress that didn't exist before. That's one part of it. The other part of it, which I will say, is what if you come from a household where you rely on that free lunch that you would get or the breakfast that you would get as an important meal of the day? What if you live in a home where there are domestic violence issues, or you're having difficulty interacting in terms of with your parents or other things, and going to school was that safe haven that no longer exists? The ability to access reliable adults in your life can't happen because you're on a screen or you're on the phone in a home where everyone else is watching, right? So we've seen a lot of more referrals specifically for our domestic violence programs, or referrals for kids that have been abused. We're seeing that. The other thing that we're seeing, and I think this is when we say there's a mental health concern and a level 5 that's coming. Before COVID happened, we already had the highest suicide rates in the last 30 years. We were already seeing the opioid epidemic out of control. Well, guess what happened when COVID happened? A lot of people lost access to care. A lot of people couldn't go to see their therapists or their providers. But more importantly, the level of stress that's come on has only surmounted that substantially. And so when we get into this conversation, part of my fear and part of what compels me to lead up this BCF effort is really the fact that I can tell you without a doubt that we are going to see increases in the suicide rate. And we are, just like the rest of health disparities, we are going to see a higher rate of completed suicides. We're already seeing it in younger Black males. That's already happening, right? When you look at people that are having difficulty with depression, with substance use, it is very specifically impacting communities of color more than others. And that has a lot to do with access, right? And so when in terms of kind of what Sheppard Pratt has done, I will say, I do fundamentally feel that if you don't have a roof above your head, you don't have food on the table, you can't manage basic finances, you're not going to think about your mental health, right? And so just in Baltimore City, we have mobilized over $2 million of emergency housing dollars for homeless veterans. And so that is currently keeping people in hotel rooms as opposed to on the street. For specifically young families with young children, we have provided over 350,000 diapers across the state, because that is something that's particularly important. We've provided over 500,000 meals to people that wouldn't have eaten for that day. And so that's, and we've done a whole host of addiction prevention services, right? We then move on to kind of the mental health part of it. And I think, while we all sit here on this platform and we're able to talk to one another, I think from a equity perspective and how do we have access, the ability for an entity like Sheppard and others across the community to provide telehealth services has been huge. We've already completed over 350,000 telehealth visits. Of that 350,000, 90,000 of those visits were only by telephone. And that's a particularly important one in the BCF world because we know that there's a digital divide, right? So if you want to get into the most vulnerable communities, if you want to get to people that really need our help and can't access it, being able to provide care, on a Zoom would be fantastic. We do that. But if it is by telephone only, that's fine too, because those are the touch points that keep people alive and going. The other big thing that I'll mention as we talk about these things is, as much as we say these things, we know that right now people struggle with accessing services. And when you look at where services exist, and this is kind of, I'll say my big plea and what I've been working on is, we don't have enough people of color who are the actual therapists, who are the actual psychiatrists, who actually provide these services. A lot of being able to talk and discuss things is you have to have someone that understands the journey that you've been on and gets what you've been through, but also has solutions that actually work for the environment that you live in and understand the challenges that may come in terms of the recommendations that we make. So I think that piece is huge. The second piece that's huge is, when we've looked at availability of services, and I'll say specifically in the mental health realm, a lot of the smaller providers have basically either decreased capacity substantially, or they're just not around to provide services at all. And so that's why I would say, specifically ramped up our efforts in terms of being able to provide care. And then what does that mean in Baltimore City? What does that mean in Prince George's County? What does that mean in, I'll say, more remote areas of the state, Western Maryland or the Eastern Shore? And I think that all of those things are important in terms of how do we make sure that people have access to care. Now, I want to shift a little bit to really talking about what can BCF do? What are the possibilities? And I guess the part that I'd say here is, BCF has an incredibly fantastic track record of helping in so many meaningful ways. There are already connections within the school world, within helping kids, working on things like the digital divide. And so what I would say is really for you all as donors and people that are passionate about this work, if you want to impact the mental health, I think there are things that really need to be done upstream. So we all know, for example, that childhood exposure to trauma is particularly difficult, but it also leads to health issues when kids get older, right? And so a lot of things that I would say we need to focus on are how do we prevent those traumas from even happening? How do we empower schools and give them the right information and the right knowledge by which they can better support kids today? The second part of that I will say is, how do we think about actually the question that I was asked when I started, how do people have the conversation? And I think one of the things is, if we ran into someone and we saw that they weren't breathing, we saw that they were having difficulty, or maybe their heart wasn't beating, all of us would instinctively know that we need to do CPR. But when you see someone and you think they're looking particularly withdrawn, maybe sad, maybe they even make a comment like, I just wish I wasn't here anymore. We all freeze. We don't know what to say. And so I think really, could we help people around our community know how to have some of those conversations? For all of us, we have support systems. We have people that we rely on. We have people that love us. We have communities in which we live. But the question is, right now, we are all so removed because of the social isolation. We're not going into the same rooms that we used to. We're not meeting the same group of people. And so when those opportunities occur, how do we put that hand out to help? Right. And so I think having a strategy by which we can train people to do that is particularly important. And there are specific programs that do that and provide that training. We could do that on a more, I'll say, whole scale way. We could be doing things to prevent those traumas from occurring. We could be doing things to help educate and empower our school teachers and school administration on how to better support the youth. We also have to think about those basic things that I just talked about, right? So through BCF grants and COVID-19 related funds that you all have been a part of, we've done a lot of things to help local community efforts in terms of basic food, basic assistance, and I think all of those also have to continue. But could we, for example, as we say, yep, we're gonna fund this particular program, and you didn't ask for this, but we'd love to give your folks the ability to ask some of these questions as you're giving this help or doing this thing. And I think that's part of the issue, is that up until now in our society, in our community, mental health is that thing that you don't talk about. It's that thing that's kind of tucked away on the side. And I would argue that most importantly, it's the thing that we have to bring out first and foremost. there isn't a reason why we shouldn't be able to check in with someone. There isn't a reason why we shouldn't be able to say, hey, I think you're struggling. How can I help? Right. And so I say all these points because I think it's a very different way of thinking about mental health, but also thinking about wellness. And I think right now, a lot of people are struggling. I will tell you that we are seeing people at Sheppard Pratt that have never had any mental health issues, and they are presenting now for the first time. We are seeing people that had 15, 20 years of sobriety that right now are getting tripped up on alcohol and substances again. We're seeing people that have just such sheer financial stress, potentially losing their home, losing their job, losing their business, that the only way out they can think of is to end their life than to have to face what that means. That's the reality of what's playing out right now. What I'm going to do is stop there and turn it back over to Shanesha because I know we have a lot more important things to talk about. And I look forward to questions at the end. So Shanesha?
Dr. Trivedi, that was great. I was riveted. So now we're going to ask Ms. Robinson from Keys to give her thoughts and what she's seeing, particularly over the last year. And then we're going to open it up to questions. Thank you.
Good morning, everyone. Thank you for this opportunity to come and meet and share. Over this past year, Keys has kind of what can I say? We've had to revamp our services because what we've recognized is that we're not, even though we are a youth-driven agency, now we've had to do multi-generational approaches. So we've had to revamp how we address the needs of the consumer, the needs of the community, and just educate and bring to the table just non-traditional approaches. As you all heard before, we're now faced with financial stresses. We have our consumers that are, our adolescent consumers don't have that social interaction anymore, which has totally affected them. And we have the parents who normally had their break when their children are in school are now, the school mom, the lunch mom, the resource mom, just everything. So now we've had to do a multi-generational approach. Instead of treating the one consumer in the household, we are treating the whole household. And of course, that is new training for my staff, new training for me as well, because usually I'm behind my desk. Now I've had to come into the community and help our folk out. So what I've seen since, and it's been a year now since we've had our pandemic, we've seen an increase in the need for medication management. We've seen an increase in, we've always worked towards symptom reduction. Now we've seen an increase in symptoms, whether it being PTSD, whether it being adjustment disorder, whether it being intermittent explosive disorder. We've just seen a whole realm of diagnosis now that we've had to upgrade or change because of the environment that our consumers are in. We've seen an increase. Now we have a number of consumers who need that psychiatric support. So of course, because we're a small agency, we have one psychiatrist who's totally overwhelmed. But we've heard the need that our folk need this extra service. The great thing, unfortunately about the pandemic is now we're able to have conversations that we couldn't have before. So now folk are willing to, hey, I have an issue now, or hey, I have a stressor, or I have a mental health issue that I need addressed now. Now there's no, shame to having that conversation about having a mental health issue, which is great. It's just we can't provide services to everyone. We're overwhelmed because the need is there in our communities. These folk want the help, but how do you do it? How do you treat a whole household and treat the community all at the same time? So that's been a struggle for us. The grant that we received from Bond Secure has kind of helped us with the multi-generational approach. And the program, we call it Art and Soul. It allows us to work with the family as a whole, open lines of communications where they normally couldn't communicate with one another, offer healthy outlets to kind of reduce the stress, reduce the trauma, but allow them to actually function as a family unit. And right now, currently in the program that we had funded by BCF, we have 15 family units that are actively participating. Most of them have uh, 3 to 4 siblings who participate in this program, and they love that outlet. You know, this is the time that they come together, they work on an art project, and they get so excited because they want to get this project done. So we have uh, instructors that get on with them, unfortunately, and they do an art project together as a family unit. And you should just see the joy on their faces because this is their outlet to actually not think about what's going on, whether they got food on the table or homework to do. This is their time together. And you should just see the joy that they have on their faces. And, most the sessions are an hour, but most times we kind of extend to an hour and a half because they want to get the project done. That completion is so important to them. Um, and it's just a great thing to see, an awesome thing to see. Um, goodness, there's just so much to say. Um, goodness gracious. We've also seen in our adolescent consumers ages 16 to 18 an increase in substance abuse, whether it being marijuana, whether it being alcohol, whether they're trying something a little harder. We've definitely seen an increase in our number of adolescent consumers who now need that treatment. We also see a number of consumers, adolescent consumers who are exposed to violence, and violence not necessarily just being in the home, but in their community. They're out there fighting for their lives. We know the murder number here in Baltimore City, and that's always been a concern that, hey, one day it could be one of our young Black boys or our young Black females who end up being a victim of violence. So that's another thing that we have to address. So as well as addressing the need for, mental health and addressing the need for making sure they have enough food on the table, now we're giving them safety, hey, you got to be aware of your community. So there's another thing that we've also touched. So there are a lot of things that we've had to revamp. Instead of being our traditional mental health program, we've had to add a little more things, add some things to it. So now, as well as teaching life skills and getting our consumers to increase their completion of ADLs, activities of daily living, there's a number of things now that we have to address. So it's not just doing mental health, it's not just doing substance abuse treatment, it's not just doing targeted case management. We have to do it all now. So, I always tell my staff, we're wearing multiple hats now. We're the, we're the, the community advocate for them, linking them to resources to make sure that they have food on the table, they're able to pay the rent, to keep the lights on. We're that IT person helping them with making sure that the kids have access to internet to make sure that they have, they can get their schoolwork done. We're everything to these folk. And, I praise my staff every day because they're in the trenches and they're wearing these multiple hats. And I always have to do my daily check-ins with them and say, hey, are you okay? Because they also wear that same weight as most of the consumers that we provide services to. So I'm thankful for them for what they do. I apologize for that. So again, it's been really rough. We've adapted, and we adapt every month because it's always something new. And right now we are addressing the increase in substance abuse. We definitely are addressing the increase in symptoms. Symptoms have definitely, where we've got them reduced, now they've increased or even changed. We're addressing that. We're also addressing now that we have a lot of younger consumers who are actually drinking and using substance. which is, another thing that we have to tackle as well. So now we're doing early intervention services to try to, stop that 12 and 13-year-old for having a substance abuse issue. So there's a number of things that our communities are faced right now, not just the pandemic by itself, but all of that extra stuff that adds all of that weight to what they're dealing with, besides wearing a mask and making sure that you're social distancing, that you go get your COVID vaccination. They're dealing with a whole lot of other things, the violence in the streets of Baltimore, making sure that they get their families fed, making sure that they maintain employment, make sure that they have the linkages to resources to make sure their families are good. So that weight, we're there in the trenches, like I said, helping them maintain that weight to make sure that they can survive. And like I said before, we're teaching our families survival skills because that's the mode that we're in right now. It's all about survival.